everybody. Thank you so much for being here this morning. Welcome to the third WeCAN Rural Solutions Roundtable. The focus today, of course, is on solutions that are being implemented in rural places in the West related to addressing mental health care. I think Michelle mentioned to please take a moment to rename yourself, your name and your state, and we'll do a little more on introductions in a couple of minutes. But for now, that will just facilitate networking so people can see where you're from. If they're from your state, they might want to get in touch with you and vice versa. We will start recording, or we have started recording, and the only parts of this that won't be recorded are when you're in your breakout sessions. So just so you know, all of this, you'll be able to go back and watch, rewatch all of the speakers' presentations after today. And I apologize, my video is off. If you weren't here to see me get dumped off internet, off the Zoom 3 times. But I'm having unstable internet for the first time in months, of course. It happens this morning. So Michelle, go to the next slide. Okay, I'm just going to say briefly a little bit about what WeCAN is, the Western Community Assessment Network. It's an AFRI-funded project that started in 2018, and a group of folks from land-grant universities and partner organizations that were implementing a community assessment program called the Community Review all came together to learn what we were seeing that worked, what didn't work in communities with the Community Review program, and come up with ideas to redesign the program to make it work better for communities. And we did that, and that has since evolved into including a peer learning network opportunity. We noticed that rural leaders were telling us they felt awfully lonely sometimes because there are so few rural leaders in each community sometimes. So we have been hosting for several years now a monthly peer learning network meeting. It's always welcome, never obliged to join us kind of group. So if you'd like to sign up for that, please go to the westerncan.org website and sign up. We don't send out a lot of emails, but you'll get information about our monthly topics, and they're short, an hour long. We usually have somebody doing a short presentation, and then lots of time for discussion. We also started something called a community boot camp when COVID came along, because we wanted to have an opportunity for communities to be doing some work virtually during the pandemic and following the pandemic, and focusing on recovery efforts. If you want to learn more about that, also go to the westerncan.org website. We have also collected just a ton of data since we have started this project back in 2018. We've been doing ripple effects mapping with communities that have participated in all of our programs, as well as focus groups and interviews. And we're in the process of putting out a lot of publications right now. And so those are also being updated on the website as we go. And I should circle back and say, if you're interested in knowing more about what a community review is, the community review reports from all the communities in Idaho, Montana, and Wyoming that have had community reviews since the year 2000. These are long-standing programs, are on our website. You can access those. So if you're interested in that, and you can find out more about the organizations in each state that have been doing them. There's been some changes recently. So for instance, I don't think the Wyoming Business Council is going to be doing their community reviews anymore, but University of Wyoming Extension is. So they're gearing up to take that program over. But of course, let us know if you have more questions or interest in any of this. And do go, if you're interested in the challenges of housing and workforce issues in rural communities, we have a ton of resources in our Peer Learning Solutions Roundtables pages on our website. The recordings, and we also build resource guides for each Solutions Roundtable, which is something that you all are going to receive in the next couple of days for mental health solutions. So I'm Lori Higgins, and I am at University of Idaho, and I'm a community development specialist in the agricultural economics and rural sociology department, and I am the director of WeCAN. And Michelle Archie and Elizabeth Sloan are my colleagues on this project and have been since the get-go. And that we're a small but mighty team. And today Michelle's going to be managing all the Zoom keeper activities. Elizabeth is going to monitor the chat, and Elizabeth and I will be participating in breakout sessions as well. And I want to thank everybody for being here, and especially all the speakers who will introduce in a couple of minutes. Greatly appreciate you being here. And I'm really glad that we get to share the good work that you're doing, and hope that all of this ripples out into a lot more good work around the issues of mental health in our communities. Please do keep your camera on as much as you can. I will try to do so, but again, I'm having internet problems this morning, so I keep getting bumped off the Zoom, but hopefully you're all having better luck with that than me. So we'd like to know who all is here today. And we'll put up a map in just a minute that shows all the states that you represent, or at least the folks who registered for this event represent. And because we have about 200 people registered, and they're from 30 plus states, we are going to have you type your name, community, or organization, and one question about mental health care that's on your mind into the chat, but don't hit send. We will call out your state or region, and when we call out your state or region, everyone from that state or region will hit enter at one time. And that way, like folks from Washington, D.C., for example, won't have to scroll through 100 chat messages to find the other people from their area. So go ahead and type that in, but don't hit send yet. Just going to give you a minute. And we're going to lean on the Idaho folks first. Go ahead and hit send. Awesome. How about Montana? Great. How about Wyoming? Fabulous. How about folks from other states in the West? How about the Central region? Otherwise known in some cases as the Midwest. And those of you in the Eastern time zone and Eastern part of the United States. Wonderful. Thank you so much. So today we're going to do a brief overview of the survey results. When you all registered for this, we asked you a few questions and we thought we would share a summary of that information with you. Then we will invite our keynote speakers, Chuck Strand of Rural Minds and Kelly Cabina, the USDA Rural Development Rural Health Liaison, to speak. We'll have some small group discussions about some top of mind, off the top of your head, idea-friendly opportunities for rural communities that may be sparked by our keynote speakers. We'll take a brief break, and then we'll hear from our folks in Idaho, Montana, and Wyoming about solutions that are being implemented in communities in those states. After another break, we'll spend about 25 minutes in breakout rooms where by topic, and you get to choose which breakout room you go to, and we'll come back and share a few ahas and interesting things that came out of those discussions, and then wrap up about 12:30 Mountain Time. And in case you're interested, these are all the states represented by the folks who registered for the Solutions Roundtable today. We have found with all of our Solutions Roundtables that there's a lot of interest in the issues we focus on beyond our 3 states that are involved in our AFRI project. So we've sort of ramped up sending this out to our national networks so that more folks can participate, because we're virtual. Why not? So thank you all again for being here. We really are happy to meet you all and to start learning from each other today. So one of the questions
we missed, Lori, I can do this if you want.
Okay,
we
go.
missed Iowa on our map. Sorry, Casey. Iowa's here. Yay. We'll fill that in for what we put on the website. So just super quick, few insights from our participant registration survey. So who registered? We had about 200 and maybe 15 people register for the event. And this is a snapshot of who we are. So lots of folks involved in education, lots of folks involved in related nonprofits, and a really good chunk of folks who are policymakers, service providers. And I love seeing this interested community members, just people who don't necessarily have a specific affiliation. And then there's a big chunk of other people who work in a lot of different areas. So workforce development, housing and homelessness, people from state, regional, and federal government. And I loved seeing these folks pop up. Non-traditional sort of community-based approaches. These are things like a theater-based dialogue project in Montana, a person who identified themselves as being from a think and do tank, and then folks who are working in food and farm related programs and organizations, some folks with criminal justice, some people who do peer support. So really great kind of cross section of folks here. And I think we've got a lot to learn from each other. So I'm not going to talk for very long. So the most serious issues related to mental health in your community, I think kind of hands down the leading answer to that was the stigma of needing mental health care. And we'll be talking about that a bit through the keynote presentations and also in some of the solution stories that we're going to talk about. So these slides will be available afterwards if you want to look at these later. I'm not going to read through everything, but I think that there's a lot of agreement that there are pretty significant issues around mental health in rural communities, but also a lot of agreement that there are things that we can do and are willing to do to help be a part of solutions or of ways to address or reduce stigma or just reduce the impact of mental health in our rural places. And so a lot of us are willing to do things like advocate for local resources or help be a part of breaking down that stigma, take trainings or help bring trainings into our communities, all these other things that we can do from where we sit. And the reason that we ask this question is because the Solutions Roundtables are really about what we can do from where we sit. So I welcome you to all be a part of this conversation. We are going to be having a lot of presentations, but interspersed with opportunities to ask questions. So at the end of our keynote speakers, we'll have at least a few minutes to ask questions and have a brief discussion. But we want to hold that until both speakers have finished. So if you've got questions and ideas, you can add them to the chat as we go along. And then we will have the breakout rooms that Lori talked about and a chance to just all talk together at the end. So our keynote speakers today, I'm so grateful that Chuck and Kelly have joined us, and I'm going to do super, super quick introductions. In fact, you can read them along with me because I want to give them more time to talk, and they'll sort of introduce themselves and where they come from on the way. So Chuck Strand, as Lori mentioned, is the executive director of Rural Minds, which is a nonprofit that is kind of an information and advocacy organization. I think that's probably fair to say, and provides mental health information and resources specifically in rural areas. And Kelly, again, has rural chops. So since 2022, she has been the USDA Rural Health Liaison, which I think sounds like a really fascinating job, working across all of these different parts of USDA that touch rural communities, and figuring out what all of those have to do with rural health or health in rural communities. So I am going to stop sharing my screen and just turn it right over to Chuck to take us on to your presentation. Thanks, Chuck.
Chuck, you're muted.
Thanks so much.
And thank you, Michelle. I appreciate the opportunity to be here, and thank you to everybody who's joining the presentation. I'm very excited to be here, not only because it's always a pleasure to share important information, but particularly this audience is just filled with people who are doers, which is really exciting because that's really speaks to one of the programs that we just recently launched, and I'll talk about that a little bit later. But again, my name is Chuck Strand. I'm Executive Director of Rural Minds, and my roots are in rural America, where I grew up in a very small town near Lake Superior. But currently, I'm in Illinois, just outside of Chicago, and Rural Minds is a virtual organization. So we are all over the place and very familiar with the Zoom and other opportunities for virtual connections. So thanks again for being here and for inviting me to join you. So I wanted to start with just the story behind Rural Minds. Our founder, Jeff Winton, is a dairy farmer by throughout his entire life. So he grew up on his family's dairy farm, and what really was a tragic inspiration for Jeff and founding Rural Minds was the death by suicide of his nephew Brooks. And at the time, Brooks was 28, father of 3-year-old twins. Everybody just thought that he was doing just fine, and so it was very shocking when he died by suicide. And Jeff and his family made the courageous decision to speak openly about the death of Brooks, even though a lot of people in the rural community were encouraging them to just say that Brooks died by natural causes or whatever else. But I think that the power of people sharing lived experience is just so important for breaking down the stigma. But it is also potentially traumatic. So I also wanted to bring up the 988 three-digit calling code. So if and many of you may be aware of this already, but if you or anyone in your that you know of might need to speak to somebody to talk about a mental health challenge or even a question, I've called the number before, and it's staffed by professionals who can answer questions, and it's not just about crisis situations, although that's the the focus of much of what they can do. But they're also able to just answer questions in general about something you might be experiencing or a friend or loved one. Our mission is to serve as the informed voice for mental health in rural America and to provide mental health information and resources. And serving as the informed voice is quite a heavy lift, so we certainly can't do that by not connecting with organizations throughout the country who are focused on rural initiatives. Another reason why I'm so excited to be here today speaking with all of you, and hopefully this can create a dialogue, not just today, but also ongoing to get information and input from people in different parts of the country. What are the unmet needs? What are the underserved areas? What can Rural Minds do in partnership with you to help make a difference? And our vision is really breaking down that stigma that's so detrimental for those conversations around mental health in rural communities. So there truly is inequity for mental health in rural communities, as I'm sure that all of us share that knowledge. But compared with urban people, folks in rural America, they have higher depression rates, higher suicide rates, but they're less likely to access mental health care services due to a variety of reasons. This is a shocking stat from the CDC. So people in rural communities are 64 to 68% more likely to die by suicide than people in large urban areas. And the previous stat from the CDC was there was a 25% heightened rate of suicide for rural communities, but this came out about a year ago. It's the most recent stat, and really establishes that there is an emergency, a mental health emergency in rural America. So out of the 46 million people who are in rural America in 2020, 12.7, or I think it's about 28% or something, works out to rural adults had some type of challenge with mental illness. And the suicide is nearly twice as likely for people who are in the agricultural industries, farmers, ranchers, others who are in doing similar occupations. Unfortunately, youth living in rural Americas are at a greater risk of suicide than other areas, and that is growing at a faster pace. So here are some of the inherent barriers to mental health that are common in many areas in rural America. Just the lack of mental health care professionals, whether it be a psychiatrist or a a PCP, a primary care physician, psychiatric nurses, practitioners, and internet, which is an option obviously for all of us here today and can be an option for telemental health services in much of America, is not always an option for people in rural communities, with 28% not having broadband at home. And many people who do have broadband at home, it's not reliable, it can be really expensive, so that can be another barrier. There are also lifestyle challenges. And the first one that is at the top is really kind of, I'll circle back to this later on, but this barrier of asking for help. And I think that when people are, when they grow up in a small town or on a farm or a ranch, just by the nature of what you need to do to get things done, you often have to rely on yourself. And that's a celebrated quality, and it's part of the many of the mindset of people who live in many people who live in rural communities have this mindset of, you know, wanting to do it themselves and being independent. And so that can be a barrier to asking for help, especially for a condition that might be as highly stigmatized as a mental illness or some type of question or concern. There can be a lack of trust to maintain confidentiality. So some of the the best things about being in a small town is that everybody knows you, and that can be a good thing, but it can also be a barrier in terms of wondering if what you might be experiencing, if you talk to somebody locally, if it might be common knowledge to everybody, and you might not want that. There's a fear of being judged, and this goes back to the stigma. Many people are afraid of being thought of as less competent or less capable, and the power of those lived experiences of people that are dealing with a mental health situation can be so empowering, because it lets people know not only that they're not alone, but that you can effectively manage a mental health condition and be very functional, very competent, very capable. There's a difficulty getting an appointment. We talked about that as far as the lack of professionals, and the distance to get to talk to somebody in person can be another barrier. Internet, mentioned that. Lack of adequate health insurance. So this is more of a barrier in rural communities than others. And that feeling of isolation. If you feel like you can't really have access to talk to somebody outside the community who really gets it, that can be a barrier. And 988 currently is available to everybody. So even if you don't have internet, typically people have a cell phone. And by dialing 988, it's a help, it's connecting you with help for someone who can speak as a professional. The ideal situation is going to be, hopefully down the road, there'll be another number that'll be affiliated with 988 that's going to be specific to rural communities, agricultural communities. So when a caller would connect with someone who answers the phone, that person answering the phone would be able to relate to some of the challenges that are unique to being in a rural area. The weakening economy and financial instability, it's hard to feel secure and stable if you're worried about paying your bills. And just this solitary way of life. Any segment of the population that is marginalized in suburbs, cities, those folks are still out there in rural America. They're just even more isolated, and they feel more alone. So that's another huge challenge. So the program that we recently just launched is called the Rural Mental Health Resilience Program. And I just wanted to give you a quick peek into this, because it's really a partnership with the Rural Minds and the National Grange. And the National Grange, as you may know, is one of the oldest nonprofits in the country. They were founded in like 1850. And back in the day, they were like the town center of rural communities. They still are to a certain extent, but they also do legislative advocacy specific to rural initiatives. And combined with Rural Minds, we work together to develop this Rural Mental Health Resilience Program. And it's really all about, number one, first of all, establishing the fact that there is an emergency based on that information that we just dealt with, along with some of the challenges. But it's really a program about hope. It's one thing to recognize the reality of a challenge, but we want to give people the information, the resources, the tools to be part of the solution. And that's why, back to this group being a group of doers, it's really exciting, because the program is designed for people to access free materials, do as much or as little as they'd like to do, but to be able to truly do it themselves. We kind of honor the mindset of people being self-reliant, self-resilient, independent, and we want to make that a benefit by empowering people with what they need to be making a difference in their local community. Having these tough conversations that are uncomfortable but they have to be heard. We have to have some dialogue to start with addressing the problems of mental health in rural communities. And people, especially in rural communities, want to get their information from someone they know. They want to look them in the eye. They want to be able to shake their hand. They want to trust the source of the information, especially if it's something that's potentially as stigmatized as mental health information. So we really are excited about rolling this program out to all of you, to all the people in the National Grange Network of 1,500 locations. Every one of those locations has people who are known in the community, who are trusted. And by empowering those people to have these conversations and then kind of start the network growing and growing and building on this momentum of being able to reach people who are isolated with conversations, with printed materials. If someone can't access the internet, all the content that we've developed is in a PDF form. It can be printed out by somebody else, mailed to them, distributed at events, whatever it might be. But we really want to empower people in rural America with this information so they truly can help to improve mental health, help minimize the stigma of mental illness in rural communities.
Great. Hey, Chuck, I'm giving you a 2-minute warning.
Okay, so here's some of what we've got going here. And in the breakout session, I can go, actually, if you're interested, I can even do a quick virtual tour of what we've got going on. Snapshot of some of the stuff that we have in the Rural Mental Health Resilience Program. And it includes hosting, if someone's interested, their own community conversation. We outline exactly how to do that. Again, empowering folks with what they need. So we can go more into this, but some of the ways specific to use the program. In addition to the Rural Mental Health Resilience Program, we have other resources that are developed to just help confront the mental health challenges and the stigma in rural communities. We've got a newsletter, and all these are available on ruralminds.org. And you can download and read old newsletters, archived, or the current one comes out. And please opt into our email list, and we'll send you the next email is coming out next week, or excuse me, newsletter coming out next week. We have a series of webinars that we do, and they're all recorded content, some really great stuff that's on the, and it's all, agenda is time coded, so you can jump to what you're most interested in. And we just really encourage people to be part of the solution. So, confronting the emergency in your local community, having those tough conversations, knowing the facts, serving as a trusted source of information, empowering yourself. And we've got to work together because not everybody has the ability to speak up. And sometimes the loudest cries for help are silent. So I just want to thank you again for the opportunity. Here's my contact information, and would love to hear from anybody.
Thank you, Chuck. And Chuck will be, as he mentioned, in one of the breakout rooms. And Chuck, I'm putting your email address in the
Thank you.
in the chat. So Chuck will be in one of the breakout rooms, and he will be doesn't have to be all focused on that program, but if you've got if you have any questions about this program, the Rural Resilience Program, or anything else that Rural Minds does, that would be a great place to connect with Chuck. So thanks again, Chuck, much appreciated. Kelly Kubina, I have your slides ready to go, so just say the word.
Okay, well, I'm really glad you do, because everything on my computer is like busily crashing. So hopefully it will all be fine. Well, thank you for having me today. I really appreciate it. Luckily, I printed out my notes, so I'm not relying on the computer to tell me what to say. So that's good. As Michelle mentioned, my name is Kelly Kubina. I serve as USDA's Rural Health Liaison, and I can share a little bit more about what that means in just a few minutes. But I'm excited to be with you today, and also excited to be able to share a little bit about what USDA and rural development, which is where I sit, do related to the behavioral health space. So to begin, I want to cover a little bit about kind of the background around rural health, and particularly some statistics around rural behavioral health. And then I'll get to information about USDA and how we support behavioral health and also rural health more generally. And then lastly, I'm going to share a little bit of information about our RD programs and some other resources that you might find helpful. So, kind of to start out with the presentation today, something that always is very meaningful to me. We know that about 2 out of 5 adults report symptoms of anxiety or depression. What we also know is about 1/5 of the US population resides in rural areas. So that translates into millions of rural residents that can face symptoms of anxiety or depression. But we also know that rural areas have lower supplies of mental health care providers and lower access compared to urban areas. So those same millions of people also face additional barriers to care. At the center of the mental health crisis is really that severe shortage of behavioral health providers. We know that more than 1/3 of Americans live in a designated provider shortage area for mental health care. And the communities really have fewer mental health providers than they need. But here's the other thing we know about rural America. You know, for centuries, rural Americans have driven the country's economic growth and provided the country and the world with food and fuel, and they continue to do so today. There are small business owners that are revitalizing main streets. They care for our land, ensuring that all Americans have access to nature and recreation. Rural communities are tight knit, and the loss of someone to mental illness is really impactful to the entire community. We know that rural areas had on average higher suicide rates. I think Trin just mentioned that, and lower supplies of mental health care providers when compared to urban areas. And we also know that particularly in the agricultural space, farmers and farm workers often face unique behavioral health challenges and suicide risks. So from your neighborhood to your physical health, many factors do come into play when it comes to mental health. And supporting rural health requires partnerships among government, philanthropic organizations, healthcare organizations, community-based organizations, and agriculture and industry. So part of what we do at USDA, and specifically in rural development, is trying to promote a healthy community and the environment. And rural development does that largely through financial assistance, grants and loans for capital costs that try to help ensure that children and families and people across rural America have access to behavioral health care and other important community facilities that can impact mental health, like safe and stable housing, strong community resources, and recreational opportunities. We can also make a difference in reducing stigma by continuing to talk about mental health, just like we're doing today, and then about the importance of seeking care and staying healthy. USDA is working with healthcare providers and farmers and ranchers and community leaders every day to talk about how mental health is understood, perceived, accessed, treated, and integrated into and outside of healthcare settings. Okay, USDA. What do you think of when you think of USDA? A lot of people think of like prime grade beef or organic produce or maybe national forests, depending on where you live. But do you think about hospitals and doctors' offices and telemedicine and health and safety training? USDA is a very large agency, and we have a very expansive mission. We have 8 of what we call mission areas. That's these little orange and green boxes there underneath. Those are like agencies unto themselves. But we do work across the department on many issues, and particularly rural health is one of those issues. Just to give you a few examples of the different parts of the agency, like WeCAN is funded by the National Institute of Food and Agriculture, which is under the Research, Education, and Economics mission area. They also fund rural health and safety education grants in the Farm and Ranch Stress Assistance Network, to name just a few. REE also houses agencies like the Economic Research Service that undertakes research on important topics for rural health, including recruitment and retention of health care providers. We also have partners in supporting rural mental health in the food production and conservation mission area, where they have devoted resources to training their field staff. Farm production and conservation mission area, that has the Farm Services Agency, as well as Risk Management Agency and the National Resource Conservation Service. They've really devoted a lot of resources to training their field staff in mental health literacy so that they can support the farmers that they serve. And in food, nutrition, and consumer services, which is where the typical food programs you might think of, like SNAP and WIC, reside, that support families' nutrition and food security. And lastly, the little green box over there is rural development, and that's where I sit within USDA. We play a big role in funding capital costs associated with rural economic community development, including for government services, healthcare, and health supports. Next slide, please. All right, so rural development, more little graphs here, has 3 agencies: the Rural Housing Service, Rural Business and Cooperative Service, and Rural Utility Service. And I'll talk a little bit more about those in just a second. But we are also unique in that we have an innovation center, and that is where I sit within rural development. And the innovation center is really kind of just what it sounds like. We are a place where we get the luxury of having the opportunity to think about how we can do things differently, or to support our programs in being able to deliver our programs even better than they do today. So we have folks that focus on data analytics. We have folks that focus on our own regulations, and then folks that focus on partnerships. So it's a great place for somebody in my position to be able to sit. One of the things that I think is really great about rural development is that we are primarily staffed out of our state offices. So those are USDA employees, but they are located across the country in rural areas. So when you get these slides, I think if the Adobe transformation has worked properly, you'll be able to click on that map and actually get to the website that will give you all the state contact information. So we have 47 state offices, and those are really the front door for rural development. You also notice there's a little green text down there on the lower right. That, again, provided the links will work, will take you to our page that reflects all of the open funding announcements. So many of our funding programs are open at certain times of the year. If you go to that particular link, you'll just get everything that's open. So I show you this map, as I mentioned. One of the first stops we're working with rural development is your state office. They are really the boots on the ground for our work and can work with you to identify whether or not you have projects that we can support. So next slide, please. Okay, so I promised I would come back and tell you what a rural health liaison was. In the 2018 Farm Bill, Congress created the role of the rural health liaison and listed out 9 long things that the person was supposed to accomplish, but it really kind of boils down to coordinating and collaborating across USDA, particularly between USDA and the Department of Health and Human Services, and then with other partners to promote rural health. And then also to share information and data related to our programs with customers and partners, but also bringing rural health information into our USDA programs and sharing that with our partners. So just a few accomplishments kind of highlighted here of some things that have been accomplished in the last couple of years where I've been in the job. We've created a rural health information hub within our intranet inside of USDA. And what that has is an inventory of USDA programs and products related to rural health. The reason I tell you about that is nothing in that table database is secret. It is literally on the internal internet because that was where I could get it quickly. We are working this year, hopefully, to be able to turn that around and make it available publicly. But as of right now, if you know somebody with a USDA email address, which you do now, you can give me a call or give me an email, and I'm happy to work with you to kind of filter out the kinds of things you're interested in and let you know what we have. We have a handy dandy little print button, so we can just print things out of the database into a spreadsheet. A couple other things to highlight is every year we do something for Mental Health Awareness Month. So last year we did a workshop series. So again, there's a link on the slide there. We do outreach around Rural Health Day every year. And then part of what I do is lead USDA participation in many cross-governmental efforts, including the Social Determinants of Health Playbook that came out last November, I think, and the implementation plan for fentanyl adulterated with xylazine that came out, I think, late summer last year. And then I'm also working on an update for the National Drug Control Strategy and the National Suicide Prevention Strategy. And then lastly, we're doing a pilot project with HRSA as part of HHS around maternal health. And I think that's it. Next slide, please.
Hey, Kelly, I'm delivering this slide to you with your 3-minute warning.
Oh, God. I usually talk plenty fast. Okay, so I'll go quick. The key thing here is really just pointing out that rural development, we really are in the business of the social determinants of health. So we do fund healthcare related projects, but we fund so much more. So housing, safe drinking water, safe wastewater treatment, businesses, electricity, broadband, all kinds of things. So you can move to the next slide, please. So we have over 70 financial assistance programs. As I mentioned before, they are largely focused on capital costs. And then there's some examples there. I'm going to go quick. Let's go. Next one. Because I want to share with you a couple of examples. One program that we have is our Essential Community Facilities Loan and Grant and Loan Grantee program. And that's really for public bodies, nonprofits, or federally recognized tribes to support the provision of essential community facilities in rural areas. So rural, in the case of the direct loan and grant program, is under 20,000 population. For a loan guarantee program, it's under 50,000. I did want to highlight a project that we funded in the last year in Montana. And I'm going to slaughter this name probably, but Mirus Healthcare Clinic in Shelby, Montana. So hopefully somebody is on from Shelby who can correct my pronunciation. But what they did was take a vacant big box retail space in the rural community and retrofitted it so that it could become an affordable healthcare clinic in the community. They were funded in part both with a guaranteed loan from Glacier Bank in Montana, but also an emergency rural healthcare grant that was funded under the American Rescue Plan. So both programs are really designed to invest financial resources to help build essential community facilities. And one thing I'd like to underscore about community facilities funding is we've done some research. Our USDA staff in the Economic Research Service and in the Innovation Center have conducted research, and they found that communities that received community facilities health funds in the last 5 years actually fared better in the COVID pandemic than others as far as the health outcomes went. So they had 220 fewer deaths per 100,000 cases from COVID-19 in the last 5 years. And it was correlated with the investment of the community facilities program. So that's pretty exciting. You know, we can tell that we are making a difference right on the ground. Next slide, please. Broadband. Lots of broadband programs within rural development, but one in particular I want to highlight is the Distance Learning and Telemedicine Grant Program. And the announcement for that should be coming up in the next several weeks. So I'll make sure Michelle gets it once it actually gets rolled out. But this is a program that's really evolved over the years. It is about buying equipment and supportive infrastructure for distance learning or telemedicine. So in the first years of the program, a lot of it was about buying big monitors and modems and things along those lines. And it's really evolved into mobile care or being able to connect educationally between areas where you might have specialist healthcare providers and areas where you do not, so that people can get trained. It's a really neat program, and they do a lot of great work. And one more example to highlight. So hopefully again, somebody's here from that. The Wilder School District in Idaho received a grant under the Distance Learning and Telemedicine program this year to equip some hub sites and remote student sites in Canyon County, Idaho. They got telehealth carts and laptops, and it was a way to allow behavioral health professionals from Casey Family Programs to use the systems in the Wilder School District to deliver mental health care services, including substance use disorder and suicide prevention treatments. According to Wilder School District, they actually are a big part of a rural and agriculturally rich community where over 70% of the town's population comes from a Spanish-speaking household. They have some full-time remote students, and they've been really proactive in being able to care for their students. Again, hopefully somebody's here from the Wilder School District and maybe can talk a little bit more about this in the breakout groups, but I think that's a really exciting project that they're doing. Okay, next slide.
All right, so seriously, 1 minute.
All right, highlight these things real quick. I'm not going to go through them all. There are links and you can find out more about them, but these are some things that we have that are focused completely on community development. So placemaking, our strategic economic and community development program is actually set aside from a few of our funding programs for multi-jurisdictional or multi-sectoral community investments. And then the Rural Partners Network is a large effort being conducted across the federal government right now in 10 states, Puerto Rico, 36 communities across those 10 states of Puerto Rico, where we have hired federal staff to be on the ground in those communities helping out. And then I want to highlight CORE, the Creating Opportunities Through Rural Engagement. This is innovative. It comes from the Innovation Center in that we are measuring our performance by who we have engaged with, as opposed to how much money we have gotten out the door. Most of the time, because we are largely a bank, we measure dollars or projects that we're funding. And in this case, we're measuring the engagement with the community as opposed to the dollars out the door. And I think it's been a really nice opportunity for us to hear from people that maybe haven't been our customers in a long time, if ever, why that is not the case and what we can do about that. So that's that one. Next. This is a list of resources that are beyond rural development. So we've talked a little bit about some of these. I know with cooperative extension, rural health and safety education. So you can look at these later. One I will highlight is the Office of Urban Agriculture. You might say, why do I have something about urban agriculture on a rural focus call? Because the Urban Agriculture Grant Program does not define a population. What they are looking for is community garden investment in areas where the community can use it. So you could be a very small town with maybe a city square where you want to put a community garden and be completely eligible for that program. So I am excited about that program. And then also the National Agricultural Library Guide to Funding Resources. I am the sister of a librarian. We have librarians in USDA that will work with you individually to help you find philanthropic organizations or federal programs that might fit your financing needs. And I think last one, oh, not quite last one. Some ideas of what we're doing moving forward. I mentioned a lot of these things, but farm stress is particularly something that we're focused on, and then also just trying to equip our staff with the best tools to support our customers. Now we go to the last one. This is like the best slide of all of them because it's got all the links and all the emails and all the social media. One thing I'll highlight is the Rural Data Gateway. That is something that was launched early last year, where we actually put all of our investment information in a visualization. So you can go on and go, how much have we invested in Idaho and in what? You can search on down and be able to find that in a visualization so you can see more about what we do. And that's it. Sorry for so fast.
So thank you, Kelly, and thank you, Chuck. And I'm just writing a note in the chat, just a reminder that all of the slides are going to be on the WeCAN website coming up very soon. So everyone can just breathe easy. Don't try to write everything down. I did put Kelly's email address and Chuck's contact information also in the chat, but those are also available. And if you check into a breakout room with Kelly or Chuck, you can talk to them directly about some of your questions. And Kelly, I just want to flag, if you want to look back up through the chat, there are some questions that came up that are probably questions that you can or might want to take up just in the chat. So I am now going to a different program. And we are going to start the slideshow from the current slide. So now we're going to stop talking to you. I think we're going to skip the Q&A for now. We'll have chance for Q&A later, but we want you to get to know each other, at least a few of each other's, and have a chance to talk and kind of share some ideas among yourselves. So Lori, do you want to take us through this slide and we can set up the breakout rooms?
Sure, yeah, and I just did write down a couple of questions for later. I think someone was interested, Chuck, in if Rural Minds is a grant funder, and there was a start of a great conversation about defining rural, and then a question I think for Kelly also about working with Habitat for Humanity. So we'll flag those and get to those in due course. But something that we really like at WeCAN is this idea of idea-friendly approaches to rural community solutions. And we lean on this heavily in our boot camp program, but this was developed by Deb Brown and Becky McRae. Big shout out to those two women in Iowa and Oklahoma, doing incredible work on behalf of rural communities. And they conceptualize this idea around, think differently about how we do things. We tend to think about, well, we need a big planning process to do, make change in our communities, and we need to meet for, 8 to 12 months before we actually start doing anything. And we have to have all our ducks in a row and have all the funding lined up, and we have to, and by the time I'm even done finishing this sentence, people are saying, no way. This just sounds impossible. Well, they break it down to smaller steps and less intimidating approaches, which involve things like doing an inexpensive pilot project to test your idea. So instead of waiting until you have, $1 million in funding to do a big community center, maybe get $500 and have a website, a community website and Facebook page, and call it a virtual community center, and start gathering your crowd of people that would be supportive of a community center in your community to that venue first. And then when you're ready to start fundraising, you have more volunteers, you have more resources at hand, you have more buy-in from the community, you have input, you know what people want to see in this community center, where they want it to be, and that sort of thing. And really just starting small, demonstrating the success of your idea, and then moving forward from there. Also, they are big advocates for doing your thing visibly, planting your flag in visible places so that people can see what you're doing, come around, ask questions. A lot of examples of this are like just taking the windows of a vacant building and, putting some opportunities to post sticky notes around a question written on the window. Things like that, or meeting in, you want to beautify your community, meet outside instead of in the conference room and do some actual beautification opportunities. So that in a nutshell is kind of what the idea friendly method is about. And I certainly encourage you to go to saveyour.town. That is their URL. And for $9, you can own a video that they have created all about the idea friendly method. And they actually have a few videos, but they're very accessible and short and informative, and $9. So pretty much in everybody's budget. So Michelle, did I miss anything important about idea friendly?
And we have a lot of connections. So this will help us to be able to accomplish the pizza oven and to be able to make sure that we get the word out about the event and to make this successful.
Josh, are you here with us today?
Yep, I'm on call with you. I don't have a camera, but I'm going to share my screen and share a couple pictures. Is now a good time?
Yes. So while Josh is setting that up, Josh has been a member of our advisory board and has been a graduate of the program years ago. And we have an active advisory committee. And as we were discussing some of the needs of our community and what our students need, we had a young man whose father committed suicide. And that's what Joel's referring to. And it's not the first in our community. And as we watched what that did to our students and how that effect lingers, and we watch our other students. We've got about 34% of our students who are directly involved in production agriculture. And as we watch the stresses on them and their parents and those involved in the production side of that, we were seeking solutions. And at that point, that's when Josh and Lance entered into our conversation. Joel's one of the vice presidents. We have 3 vice presidents in our chapter. Our program touches about 600 students every year, 600 individual students. And of that, we've got well over about a third of them are active FFA members. And so Joel's one of our vice presidents over building communities. And this was a direct link with him to be able to work this direction. And so Josh, go ahead on what you presented to us. And
I'm hoping that the picture I just presented is being shared. Can everyone see that pizza oven?
we can, Josh.
Okay, so that Lance and I had the opportunity to go up and meet with a group of individuals and growers and producers and mental health awareness individuals for rural communities in Washington. And they built a pizza oven out of a World War II submarine buoy, a net buoy. And they started finding correlations between suicide in their local community and social connections and reconnections. And this university extension office is near one of the university programs, which is called the Bread Lab. And the Bread Lab had a local man build this pizza oven for them, and they invite local farmers, producers, growers, anyone related to agriculture that they have any type of relationship with to come, on a regular basis, if not monthly. And they cook up a bunch of pizza, food, and they just all gather together and talk. It just makes, connections happen within the community. And I think this is so important because, as Mr. Godfrey mentioned, our community's seen and dealt with the heartbreak of suicide. And I apologize. It is a little bit of an emotional subject for me. I work in insurance, and I deal with a lot of farmers and agricultural venues. And I've had recently, in the past 2 years, I've had several clients commit suicide. And a couple of those, I felt like there was more that I could have done to help prevent that. So this has a lot of personal meaning for me, but what our thought is oftentimes people don't understand that there's other people going through the same emotions that they are going through. And our hope is, by creating something unique, something that can go out into the community, that our youth, that our adults can all volunteer to be a part of, it will be a unique enough item that people will say, hey, what's that? They're going to want to come over. They're going to want to see it. They're going to smell this pizza cooking. They're going to want to come over and have a slice of pizza. And our hope is that we can make social connections to help break down the stigma of talking about mental health and create an environment that's safe, where people feel they can belong and be supported. In doing so, we talked a lot about, if we build this pizza oven, where are we going to put it? Because farmers in Idaho are probably not going to go sit in a park and gather around a pizza oven to have a slice of pizza. So our goal is to make this a mobile pizza oven. We've had a trailer designed that has a food preparation area, a pizza oven in the middle, and a serving table around the rear of the trailer. And our hope is that we can be involved in several, local public events, whether it's fairs, whether it's, special high school events, whether a farm has a farm worker or a farmer commit suicide, we can go and be a support to those people, present solutions, support opportunities, and take people with us who have been where they are and have overcome it, so that we can help and promote healing in our community. Obviously, if we can create prevention, that is best. But our hope is that we can be a support in breaking down that stigma of, can we talk about this without it being shameful? And that's our hope and intent with this project, is to give support, promote healing, and prevention if possible.
And then I'd like to add on to that. So our high school has a nationally ranked fabrication program. And we'd like to take this opportunity with the pizza oven to be able to invest some sweat equity into it, and to make this aspect of the project more successful, and to be able to create more opportunity to use this opportunity to help out our students in our program.
We're extremely excited for Joel and his team to get involved with this project. Not only will it create a tie from them to our community, but as they work on this, it's going to get some very public attention with our news. And our hope is that youth and adults in our rural community will have some buy-in to helping their neighbors, to helping their family, and that it will create awareness in such a manner that it helps people prevent the heartbreak that we've experienced.
Josh and Joel, thank you so much for sharing this story. Are either of you sticking around for more of this, or do you both have to go?
I'm gonna stick around for a while.
Okay.
I'm gonna stick around for a little bit, but then I'll have to go.
Okay. So I was just trying to figure out if we needed to squeeze in any quick questions for you guys, because we probably got another, 45 minutes or 50 minutes of solution stories. So do you want to take a couple quick questions now just to give you more flexibility?
That would be just fine.
Okay. So anybody have questions or thoughts for Josh and Joel and Mr. Gottlieb? I'm sorry, I don't know your first name, but I can call you Mr. too. Anybody
Hey
have
Joel, do you have a GoFundMe set up for which donors can help with any of the construction costs?
I don't know if that's through. We don't have a GoFundMe set up for this. We're working with our advisory and with Lance and Josh, which is awesome. And so there are funding streams that they're looking for out there to help with that. We look at this as a community service and an opportunity for our kids to just be involved in addressing some of the feelings that they're feeling with, feel like they're part of a solution, and engaging in these conversations. So it's just fantastic.
So
You
if
guys are
there
great.
are folks in this meeting who want to dive bomb in and offer support from outside your community, is there, Josh, would getting in touch with you be a good idea?
Yeah, that would be great. Let me give you my personal cell phone number. And that way people can text or call. My number is 208-680-7100. Again, 208-680-7100. Lance Hansen's been incredibly helpful in assisting with the oversight on this. He's applied for a couple of grants. I'm applying for a couple of grants. We have some local individuals who are intending to donate materials, labor, some money. So we're really hoping that not only this will be a funded project, but also that we'll be able to raise enough funds that we can help with some additional resources to perpetuate this into the community. So yeah, all the funding we can get is very helpful.
And maybe even sharing once you get the thing built and you reverse engineer your plan from construction back to plan, sharing this with other communities would be a great idea.
We're going to document it very well, and Mr. Godfrey's going to help us with that, and Joel and his team as well.
We're trying to make it representative of our community. We were also able to find a World War II buoy. It's amazing how small miracles come together when good people work together. And we're going to make it representative. Take on the appearance of a grain bin, and it's just wonderful.
It's super great. We are psyched for this project and really happy that you shared it with us. Thank you so much. We are going to move on to Montana, right next door to Idaho. So Brenda.
That's Squaxed, and good morning, everybody. I'm going to see if I can share my screen here. All right. Can everybody see that? Minus the notes, hopefully. Okay. Well, good morning, everybody. My name is Brenda Ritchie, and I am a Montana State University Extension educator for the Flathead Indian Reservation. So I'm here to talk to you about
Hey, Brenda, before you dive in too far, can you
Yep.
start your slideshow?
Can I do what?
So it's not a big deal. We can see your sidebar. So
Oh,
just go for it.
if you tell me how to close it, I'll close it.
No, that's all right. Just go for it. No, just go if you want to go under the slideshow
Under slideshow.
item, and then just quick start slideshow. But look, don't worry about it. Just go for it.
I'm sorry. Like I said, I'm happy to do it if you walk me through it.
Yeah, that's all right.
You're good.
Okay. So they asked me to come on today to talk about 4-H mentoring. And so that's what we're going to do really quick. As a federal employee for Montana State University, I do need to recognize that I live and work on the homelands of the Salish, Kalispel, and Kasanka people. It is a privilege and an honor to build relationship here with that community. I've lived here for over 30 years. My family is born and raised here, and I've been doing the 4-H mentoring program since 2011. I am not going to read these slides to you because I want to tell you the stories of the pictures. So if you guys want to read the slides, it is an outside of the box, non-traditional 4-H program. It is adult supported and youth driven. The young ladies on the left here is a match that we had from last year. And the funny story here is the big buddy or the mentor was as girly as you can define girly, with the hair, the makeup, the clothes, the jewelry. And we matched her with a little one that had lots of the same ideas and personality traits. And during this last spring, they discovered that worms congregated and lived under the mats of the swing sets and the play yards, and were bringing me handfuls of worms. And so we had these very princessy matches bringing me worms, and I had to make up a story for the kindergartner about how the worms were going to be happiest living together back underneath those mats, because they asked if they could bring them back into the classroom, and the answer was no. So it's really about building relationships, which is very culturally appropriate for my community, as historically before Western invasion, cultural relationship and mentoring was a strong part of building identity and safety. We match up those superpowers here with our big buddies and little buddies. These gentlemen here have an experience of parents being incarcerated, of drug and alcohol abuse, and in matching him with the big buddy, this is one of our wrestling state champions. And wrestling state champion has taken him under his wing, and little guy is now wrestling and choosing positive, active relationship building through activity. I don't know how much time I have, Michelle, so just keep me on target. Currently, we have 75 youth participating this school year, and what we do is come over twice a week. Because there's so many youth, I go to the school twice a week, and the students give up their lunch hour. The high schoolers give up lunch hour to go find their mentee, their little buddy. We spend 15 minutes of one-on-one, I call it that eyeball to eyeball contact, where they catch up with their little and understand what's going on, because I'm not mom, dad, the counselor, the school teacher, big brother, big sister. I'm your buddy, and you can say anything to me. There's that change in authority relationship that really allows and gives opportunity for the little buddies to build relationship with somebody else outside of who might have control over them. I wanted to talk a little bit about this last year's graduating class. It was the first time I had graduating seniors since the start of the program in that high school. We had 16 graduates that mentored 27 buddies. And so that meant that for some of those high schoolers, they did have more than one. And that takes a special and unique high schooler to take on more than one and build relationships. I wanted to address for the community here what that might look like as a monetary donation if we were needing to hire this mentorship to come in and work with these young people from the grade school, what that might look like. And when I tell my high school seniors that their gift over their time and their hours was estimated at $16,000. Their eyes just kind of popped because they think they're just giving up lunch. Well, they're giving up lunch. They're addressing life experiences. They're building that social emotional connection to help both parties stay in school. There's quite a bit of commitment to a 4-H mentoring program. And what we see was, this is one of my high school seniors and his mentor, and they had an assignment of they were supposed to go read a story for a part of that first 15-minute one-on-one time. And I said they could read their story anywhere they wanted to. And they went and they literally dug through the brambles and the bushes to sit inside and read the story there. And so creating these unique learning opportunities outside of the classroom through this big buddy, little buddy aspect has been what gets these kids to school sometimes. It isn't always the teachers or the free food programs. It's, oh, today's my big buddy's coming to see me today. I have to be there. And I get that feedback from the counselors that say, you know, he hasn't been to school all week, but he knew big buddy was coming today, so he came today.
Hey, Brenda, slightly less than 2-minute warning.
Okay, I'm going. All right, at the end of the school year, we try to have a big party. I have one entire day, the whole mentoring time frame we have with the young people is focused on the seniors and their exit teen youth. Because I have seniors who get super attached over this 3 to 4 year process, depending on when they came in. Last year, we had superhero theme. And so everybody dressed up like superheroes, and we provide a safe conclusion and closure to the relationship as our 4th graders are transferring over to the middle school building, and our seniors, of course, are graduating. It is my personal belief that when young people are empowered to address social emotional needs, not only do they strengthen academics for themselves, the teenagers through leadership skills and connection, but that our K-4 little buddies also receive that ability to build skills that connect them academically and help maintain that school graduation rate. One last story here. One of these seniors, these were my graduating seniors last year. One of these graduating seniors was one of my mentees when he was in 1st grade. And he came back full circle. When I saw his name apply, I'm like, why do I know that name? Why do I know that name? And this particular student had been one of our highest needs little buddies. And I had a great deal of concern as to how he would be as a mentor. And I am happy to report I was completely wrong in my bias and my concern. He ended up being one of our best mentors who stuck it out all 3 years since the program started until graduation, and really built that long-term relationship and gave back what had been given to him. So super proud of him for that. And all of these seniors and the commitment that high schoolers have and the power that our youth have to change the trajectory of where mental health is right now in the state of Montana.
Brenda, thank you. Thanks for sharing this with us and the stories. I love just connecting with the kids that way. So thank you so much. We're going to hold questions until the end, and Brenda will be in a breakout room. If you want to talk more to Brenda, talk more about engaging youth, that will be your chance. Lance and David.
There, helps if I unmute myself. Okay, can everyone see what I'm sharing there?
Yep, you look good.
Okay. All right, so I'm Lance, the University of Idaho Extension. I'm in Madison County. David Collister, I'll let him introduce himself. Actually, go ahead, take him and introduce yourself real quick, David.
University of Idaho Extension in Butte County.
Several years ago, I got involved with farm stress management, mental health, and things related to agriculture. And along the way, I got connected with a group called RASSIP. A few people are on here. You'll see Dawn on here, and I'll talk a little bit more about that. But what we ended up doing was going around to several different communities, and just to improve awareness around mental health, especially around focus was around agriculture and farmers and ranchers. So we coordinated with me, David, Bracken Henderson's on here. Tasha Howard's on the call too. I think she's going to talk later. Kathy Tift and Talia Haney, who are members of our group. So we reached out to try to recruit 17 communities across Idaho. We did get that accomplished. It took a little bit of work, but our whole focus was on how do we help. Biggest thing is we want to reduce stigma surrounded by the surrounding mental health. How do we get these conversations going? How do we create awareness? So the resource we had was RASSIP, or the Western Regional Agricultural Stress Assistance Program. You can find out more about them on farmstress.us. We got a grant through them for $200,000, and we got our 6 extension educators and our mental health specialist or coordinator, and a bunch of community leaders. You met 2 of them, actually 3 of them, Josh Teakin, Lex Godfrey, and Joel Ricks. And you'll meet another one later on. She's going to share what the connection we had with them, and this from the Silver Valley. So we ended up having 80 meetings and ended up with 233 volunteers. And along the way, some of the big concerns are how do we rebuild those community connections that were lost during COVID. We found out from several communities that the funding for, in one of the communities, their dairy days was going away because it got shut down during COVID and nobody wanted to pick it up again. They had concerns about youth and their mental health, farmers and ranchers and the elderly. And what we found is that the same 10 people showed up to every meeting and they were the community leaders. How do we create these connections? How do we rebuild these connections? How do we create safe spaces? How do we get this conversation going? So these are just a few of the communities. We had the whole project was set up to do 6 meetings. And after the 6 meetings, these communities would get $3,000 to help with their action plan. So I'm going to talk about a few of the communities, and David will talk about a few of these as well. So Eden and Hazleton was one of the ones, so 2 communities that I worked with. There were 3 main denominations or religions there. And one thing I learned is they do not want to meet on each other's turf. So what they wanted was a community space that was neutral ground. So that neutral ground is super important. And what ended up happening along the way as we had these conversations, and both of these communities are like about 3 miles apart. So, you know, the population, probably under 1,000 people between the 2 communities. But they wanted this neutral ground. We started collaborating with the people they knew in the community, the people that showed up at the meetings, and we've ended up finding an old building that a church had that hadn't been used for 10 years, and they were willing to donate it to the project. So $3,000 isn't go a long way to helping them out, but it helped them get that process or the process going to get that building to where they could use it as a community meeting space for everybody to get together, have coffee, share meals, share ideas, play cards, just having a place where they felt comfortable getting together. And then I'll let you talk about Weiser, David. And did you work with Cambridge that much?
I worked with Cambridge a little bit.
Okay.
So
why don't you talk about Cambridge and Weiser, and I'll talk
Okay.
more about Rigby.
So Cambridge, we met at the library there, and that was a different kind of group. It was a lot of health professionals, the librarian, and some other groups that were working with the youth, and they were wanting to bring the resources to light. They knew there were resources out there, but nobody seemed to know what they were. So one of the projects that they did was to put together pamphlets showing who they can go for different kind of help within their area. And then they went into the schools and they did mental health, first aid training with some of the leaders in the school, and they did some kind of training. I think it was QPR with the kids, which is basically like CPR and suicide prevention for youth. And so they went that route. They were really working with the kids, and they're still meeting regularly and moving the thing forward. Weezer, that was a bunch of that was a different group too. Typically when we get to these meetings, not to be sexist, but it was usually a whole bunch of ladies that were worried about this. When we got to Weezer, this was the first time we showed up and it was a whole room full of men. And it was pastors from the different churches. There were principals from the schools, again, the librarian, because that was a neutral ground where we could meet. And they had a lot of big ideas, and we had to scale it back because $3,000 won't put in a new mental health care clinic or some other things. But they did come up with being able to retrofit a room where they could set up telemedicine in one of the existing buildings where they could help people go and meet with counselors in a private setting that people wouldn't know what was going on. And that's basically what happened in Weezer and Cambridge. And so I'll turn it back to Lance to talk a little bit more about Rigby.
Okay. So you already found out a little bit about Rigby from Joel and Josh and Alex Godfrey. This idea came about, as Josh was saying, and it was in connection with the RASUP group with Don, who's over RASUP right now and leads all that effort. And Chad did share in the chat box the article that kind of got this all started here in Rigby, Idaho. So if you want to check out that, you can check for that link that Chad shared. So thanks for doing that, Chad. So basically, it's a pizza oven to create that opportunity to have those discussions. And that's following the same model that they use there in Washington, where Don's at. So it was just a great project that fit well there. And so we're working on it still. So hopefully we'll have more information later on that. And it's been fun to work on it with the youth. We've reached out to several other community partners to get funding for that, to make sure that project goes through. And we had several other communities we worked with. These are just a few of them. Most of the communities were, how do we bring an event back? How do we create an opportunity for people to gather, to talk, and to have a good time, to create those connections again? I think that was one of the biggest things we learned, is that people were missing that. They were missing the opportunity to connect, to be around other people, to see other people's faces, to smile, and to revive those connections. That was probably one of the biggest takeaways in that, and concern for the youth and their well-being. Right now, we're working with RASUP on a second part of our project, and we're wrapping up all those other projects. And what we're trying to do is keep this conversation going. What we're hoping to do is find more funding for these communities that want to keep their projects going, try to connect them with other resources. One of the things that we learned too along the way is that several of these rural communities did have resources, but nobody knew about them. So how do we get the word out? And some of the communities, their proximity to each other could share resources, from outside the community that was only about 8 miles away. So there is a lot out there. It's just a really good kept secret, unfortunately. So we need to make sure that we get make these not secrets anymore, and make sure that everybody knows about it. And one of the other things too that we're going to work on is we've reached out to a few farmers, and we want to capture their stories in some short videos. And David Collister has a really great story that we want to capture about his Well, I'll let him talk a little bit about that in a minute. We have enough time, Michelle. We doing good?
We have maybe a couple minutes left, 3 minutes.
So we're going to do these videos, so watch for those. We'll make sure those get released. We'll share those with everybody. But I'll let David share a little bit about his story as we're finishing up here. But thanks for having us.
Thanks, Lance.
Okay, so up until 5 years ago, I wasn't an extension. I was a dairy farmer, and things changed in my life, and there was a lot of stress involved, and pandemic happened about the same time, really feeling isolated. I didn't really become suicidal, but I wondered a lot of days if there was any point in if I just dropped dead, if anybody'd miss me. And so those kind of things are stories that I wouldn't have shared 5 years ago. It's still, I'm getting a little bit better at it, but I think that we need to talk about these kind of stories, what people are going through, to help break down the stigma. And one of the things I like to say is, because I've heard it somewhere else, is if somebody's got a broken arm, nobody thinks twice about them going to the doctor and getting it fixed. If somebody's having a heart condition, nobody thinks anything less of them because they have to go put stents in. If somebody's suffering from isolation, depression, and becoming suicidal because they have a chemical imbalance in their head, we should not think any less of them because they go get some help. And by talking about it and talking about it openly and visiting and having opportunities for social connections, we can help start breaking down the stigma by being willing to talk about it. And that's what these 4 videos are going to be. I'm going to be a little bit more in depth about my story and a couple other farmers who either had suicide within their family or were getting close themselves. And so that's kind of one of our ways that we're working to break down the stigma and associated with it and try and reduce suicide. So that's all we have time for today for me, I think.
All right, David, it's not all that we have time for you in total, but it is, we appreciate you ending on time now. So David is going to be in a breakout room later about mental health awareness, reducing stigma. So if you want to talk more with David, he'll be in a breakout room later, and Lance is going to be in a breakout room later that's focused on community connections. So if you want to talk more about that, thank you too for sharing your work with us, and David for sharing a little bit about your story. I can tell it's still a little bit of a deep breath for you, so we appreciate it. Paige Olson.
Hello.
Hello, Paige.
Okay, let's see.
Now we go to the Zoom dance. Where is that window?
Yeah.
Perfect. Great.
You see it?
Yes.
All right, look at me being tech savvy. All right. Hi, I am Paige Olson, and I am my main role, I guess, I am the executive director of the Silver Valley Economic Development Corporation, located in the Silver Valley in Idaho. And I also run an run a couple nonprofits under the umbrella of Project Uplift, which is a 1C3. So Silver Valley Cares started basically, we are a nonprofit organization dedicated to bringing mental health resources and awareness to the Valley. Right now we're basically online, and then we have, a few individuals who are kind of boots on the ground, just constantly spreading the word about the different things that we do. We're mostly at this point, it's been less than a year that we have been around, but we focus on free community trainings, online resources, and then we host an annual event, and we hosted our first one last August. Some of the community trainings that we have been able to do are QPR and assist, mental health first aid, and we're getting ready to actually host a youth mental health first aid class this spring. We've done TBRI, which is a trust-based rational intervention. We helped facilitate a trauma, burnout, and resilience for our first responders. Because as anyone knows, our first responders are that they are struggle with, you know, seeing so many things. They're the first ones to go to some of the suicides and the traumatic things that happen, and they themselves need resources. So those are just a few things that we have done, and then we're constantly looking at ways to bring more trainings to the community, just to kind of help, you know, break the stigma and bring awareness. We have a website, our online resources, which I'm very proud of. I personally can't really take too much credit because I didn't build the website, but I have a team of amazing tech savvy individuals who can build websites. So this is our website, and our resource guide has kind of been my my baby, something I've wanted to do for a while. And so to see this come to life is great. Our local mental health providers now refer people to our resource guide, which is awesome. But you can just see here, I mean, we're literally, it's a full page of different things that you can jump on, you know, different meetings, different events that are going on, and we're constantly updating this for our area. And we try to keep everything mostly local, but we do have some things that are regional partners just because we are rural and we don't have everything in our area necessarily. So let's move. And then our annual event, we hosted that, at the end of August last year, and we had 55 vendors, I guess you could say. It was a completely free event. We had 55 individuals between like churches and food banks, and we had different people that like arts and stuff. Like, we wanted to bring anything and anyone that could come together on how you could de-stress, or, you know, different ways of like what helps your mental health. We didn't want people to think that you had to go and sit and talk to a counselor. You know, if you had issues, there were other ways to decompress, whether it was through art or through fitness or a church or whatever it was. And so we just brought all these entities and organizations together, and it was actually really beautiful to see. We had Silver Valley Pride was right next to a Baptist church, you know, so it was like seeing these entities that normally don't necessarily see eye to eye, but they came together for a common good. And it was just amazing to see. And we had over 700 people come. We served free food. We think we served over 650 hamburgers and hot dogs. We gave away multiple meals from leftovers to families, sent families home with food. Can you still hear me?
Yes.
Okay, just lost
And you
my
have about 2 minutes
picture.
left.
Okay, and it was just really, really cool to see that. So, you know, quickly, just why we're doing the things we're doing is Shoshone County is ranked in the lowest of the state, mainly being, you know, lack of primary care physicians and mental health providers. I mean, mental health providers is 850 to 1 is the ratio of need to providers. And so we knew we needed to do something. So partners, as Lance was talking, the U of I extension was kind of the starting off point for us. We did do a series of listening sessions, and they were actually our initial funding partner for this event. And then now I'm able to continue to do this by partnering with AmeriCorps. I actually have 5 members that I'm able to pay through the AmeriCorps initiative. So that helps. So it's not just you're continually asking people to just give their time with, you know, nothing back. So AmeriCorps has been great in helping us grow our initiative. So just kind of, you know, wrapping, it was like, find a group who cares, no pun intended or pun intended. AmeriCorps is great. They do have other public health initiatives in state, so look into it, because like I said, I mean, they are giving $1,000 a month stipend to my members, which is great. And it's just helping us kind of grow our initiative. And like I said, just do something. It doesn't matter what it is, you know, we need providers, but we knew that that wasn't something that we could do. So we started just by doing something, and it's grown exponentially this past year. And then one thing I will say, if you're looking at get under a nonprofit, whether you start one or get under umbrella, because the amount of grants and initiatives we've been able to bring in to keep this sustained, having that nonprofit is key. And then also obviously find those people who are passionate about it. And then here's just a few pictures of some of the things some of the trainings. One of our members, she's a painter. And so the heart on the bottom was our poster for our mental health fair that we hosted, and she's in the middle of designing a new one for this year, and it's going to be so cool. And we had those made into shirts. And then really quick, going back to our website, just show some pictures of our the event. So we had some of our funds that we had from the U of I. We actually had a local, it's called the Traveling Tea. We had them design some shirts for us, and we gave out free shirts as well at this event. And, you know, they all had something mental health related, like be kind to your mind, you know, break this stigma. But you can just see like how many people of all different entities, and this was a completely free event. We didn't charge for one thing at this event, and it was just really cool. And I'm really excited to see, you know, how big it's going to be this year. Oh yeah, and we had free haircuts. We gave 40 kiddos haircuts, free haircuts, and it was the week before school. So we dressed them, we fed them, we sent them to school with a fresh haircut, and it was just, yeah, it was just a really, really beautiful thing to see. And if any of you want to join the event this year, let me know. We would love to have you. And yeah.
Great. Paige, thank you.
You are very
Love the
welcome.
photos. I'm glad you ended with those. Thanks for sharing your work, and thanks for being part of spearheading this in the Silver Valley. I know that,
Yeah, it's
it's a work of
been my
passion.
pleasure.
So I'm going to go ahead and share my screen and invite Melissa Cook. We're going to do something never before attempted in a Solutions Roundtable, which is that Lisa Kunkel, who was one of the organizers of this mental health awareness and fitness fair in Bighorn County, Wyoming, was sick today. And so she helped me pull together a few slides about the event. Melissa, with University of Wyoming Extension, has been involved in this. Melissa has never seen these slides, and I've never heard Melissa's side of the story. So Melissa, I have like 4 slides, a little bit about the event and about the Yellow Feather campaign and what's happening now. So just want to talk a little bit about it, or should I flip through and tell you what the slides are? And
Real
then
quick, this is Shay. If I can jump into and help from what I know.
Oh, that's great.
Some of the slides too, if I need to. So, Melissa, just to jump in, you take the lead. But
all right, Shay. Look, it takes a village to tell this story.
Right. So I see there's a quote from Stan Flintner on here. Stan Flintner is the man who was the driving force behind this. He lost his grandson to suicide who had schizophrenia. I joined because I have a son with schizophrenia and a sister that I'm responsible for. And the group that Stan is part of is called BSED, which is an economic development group. People ask, well, why is an economic development group putting on mental health fairs? And so Stan's words are, you can't have economic development if you don't have mental health. You have to have good mental health first to have good economic development. And so he's the driving force behind this. So what they did is they had a mental health awareness fair in Shell. That was their first one. And Shell is a little tiny town of about 100 people, but they had over 100 people attending their fair. Once people got in the door, they didn't leave, partly because they provided them lunch, so they didn't have a reason to leave, but people were just captivated by the conversations. When you walked in the door, you were given a yellow feather, you were given the opportunity to ask a question of a therapist that you might not want to ask out loud. You could write it on a note card. They had a panel of therapists who then answered the questions and talked about the different topics. I'm not sure what's on the slides, but I can tell you that that was their first one. And the person that you see here on the right, if you could go back one. Person on the right, he's the one, Ralph is one of the counselors, and he is here talking about breathing exercises, which I have been out teaching the senior citizens in the senior center the same concepts that I learned from him here. And the woman who's holding the mic is Stan Flintner's daughter, Carol. It was her son who passed away, and she is finishing up her therapist degree. So the second one that they did was in Cowley. They had a calendar conflict. So they'd had this great success in Shell. They went on to Cowley. Cowley has a large population of one religion. That religion was having an event that day. And so it conflicted, and they ended up with 12 people, and it was deflating to the B-side group who had invested a lot of money into this. And so now they've licked their wounds and moved on to the next fair. But in the last fair, they say if they helped just one person, it was worth it. So as they go on to the next fair, which is going to be in Worland, the Worland group has had I've been to all their planning meetings from the beginning, and they have just had a pouring of support of donations. It's a small community called Worland. They recently had a suicide of a junior in high school, so they're motivated. They meet, again, like you said, David, a lot of women meeting in the library. The mayor is a man. He's been bringing men to the meetings. I've been watching him, like bringing them in to sit and help provide information. We've changed the name from a mental health awareness to a mental fitness fair, and the vendors are nutrition, exercise, mental health, ag stress, those types of things. This group of people is papering their community with ads. The pizza boxes have them, all of the businesses have the information. And because all these people are involved, they are aware of this conference going on. And then also the group is asking that businesses give their workers paid time off if they attend and show up to work with a yellow feather from us, that they get to have so many hours of paid vacation time for attending. And that is taking hold. This community wants to make it an annual event. And one of the things that has spun out of this whole effort is something that I did with the senior centers, which is called a winter survival skills presentation. That's about a 25-minute presentation that was given to 9 different senior centers, reaching 800 different seniors in a Bighorn Basin. And these seniors received information on cabin fever, what it is, tips on how to deal with it, and also to make it winter survival skills. I also talked about physical safety, things that you should have in your car, the temperature you should have your house at, and that type of thing. But it was kind of a cover so that I could talk more about mental health without scaring people. Because we have been aware this is a ranching and farming community. And if you say mental health, I literally had one lady curl her lip when I told her about the fair being a mental fitness fair. She curled her lip at that. So that kind of gives you the idea of what people think of when you say mental. So we're trying to reach everyone.
Right.
So did I miss anything that was on Ward or Michelle that you'd like to add?
Well, I'm just going to add a quick thing, but Shay, anything that you want to jump in here about?
No, we have a NAMI affiliate in Park County, which is one of the neighboring counties, and I heard about this event through them, and I love the yellow feather idea. Yeah, just gave me a lot of ideas statewide on some different ideas, and I would like to be at the Worland event, so I did put in the chat. I'm curious when that is.
Okay, so the Worland event is March 16th from 10 a.m. to 3 p.m. and there'll be breakfast foods and lunch. And the BSED, which is the economic group that was working on this, they believe that even though we're Bighorn County, Bighorn County has a lot of bedroom communities that support the larger communities like Cody. And so they were trying to decide, are they Bighorn County or are they Bighorn Basin? They decided they were Bighorn County, but they did the locking fingers saying that we are really interconnected with all the communities in the Bighorn Basin because we're so small and we use each other's services. And I'm sure they would love to head your direction and do a fair like this someday.
Yeah, I'll get in touch with Lisa and
and Bill Hayes, Stan
Bill Hayes.
Flintner.
Stan Flintner. I'll get in touch
Yeah.
with them and connect them with either the Park County group and even
Mhm.
myself. So thank you.
Great.
You're welcome.
Thanks, Melissa, for jumping in, and Shay for jumping in as well. I just want to point out, if you're looking at these slides afterwards, Stan Flintner, who, as Melissa mentioned, was kind of the spark behind this initially, got his inspiration, or at least the way that he tells it, from the Cheyenne Frontier days. They had a Pickup Man campaign, and they got Garth Brooks to make a little video for them. So that's in this slide deck. In case you want to see Garth Brooks and kind of how, and you can look that campaign up too, and that'll be a part of our resources guide. So thanks again, Melissa and Shay, for jumping in on this. All right, our last solution story, Danielle.
Tots maybe everybody. That's good morning. My name is Danielle Scott. I work for the University of Idaho Extension. I'm the extension educator for the Nez Perce Tribe Reservation. So I was contacted by Lori to come and talk a little bit about the work that we do on the reservation. And just to be clear, we don't work with just tribal people. We are all inclusive. So we are very privileged to be able to have the place where we're at. There's a MOU between the University of Idaho and the Nez Perce Tribe for us to be able to be there. Well, we are very thankful that we have the USDA NIFA grant for the federally recognized tribal extension program. It is a competitive grant, which really drives us to do as much as we possibly can and work within our means to be able to promote things. One of the things I brought to the table when I started this position was drawing upon the strength of our culture to promote resilience. So this is a presentation I've done a few times. I always tend to redo it a little bit depending on what my audience is. But one of the main things is that in our program is that we try to indigenize everything that we do. And so I'll talk a little bit more about that and how we go about that. Next slide, please. So this is me in the Lapwai Valley. And we were there one day for an event. And my daughters and I I bought them these blankets, which are about the backside of the blanket. You can't see that, but it's an 8th generation blanket. That's the company. And what it promotes is Native women having a voice. And that's something that we promote very heavily within our program. So I always say people that we are born to be resilient. When we're talking with youth and within the programming that we do, we talk about resilience as the ability to withstand adversity and bounce back from difficult life situations. This involves the ability to work through emotional pain and suffering. Where Lapwai is, it's the headquarters of the Nez Perce tribe, but it's also where Fort Lapwai was previously. So there's blood within the ground, we say. There's historical trauma within the ground that we walk upon a daily basis. So we acknowledge that pain and the injustices that were done to the people, but we don't focus on that because we are born to be resilient. We promote that in all of the work that we do. We acknowledge historical things happen, historical trauma, intergenerational trauma, individual trauma. We talk about that. We acknowledge it. We don't ignore it. We have to face that pain in order to be able to heal. So that's something that we promote on a very regular basis. one of the things that I'm most proud of in our programming is that we do intergenerational learning. About 80% of our programming is intergenerational. So I have obligations within 4-H and youth life skills, but also in community development and agriculture. So blending that all together is what I get to do every day. And I absolutely love my job. We work with a very at-risk group, both the youth and the adults. We also have a very high ACEs group as well. So if you're not familiar with ACEs, it's Adverse Childhood Experiences. We've done the survey several times with several different groups. It's very consistent with the high ACEs. And so if you're familiar with that, you know that there's a shortened lifespan if you have high ACEs. So we try to teach resilience in everything that we do. Next slide, please. So one of the programs that we promote is our culture is connection, culture is prevention. So what does that mean? Knowing your audience is a big part of what you need to do in order to know how to best address the needs. And so we do an ongoing needs assessment on the regular. I'm continuously talking to our youth. We like to have our programs for the youth be youth-led. What do they want? What do they need? And then how can we implement resources to be able to accommodate those needs? We also know that there is a need amongst the parents, the grandparents, and everybody along those family lines to be able to promote resilience for the betterment of the families currently and those that are yet to come. So I wanted to share just a couple pictures and tell a couple stories. The young lady that is looking at the petroglyph to the left side is from one of the trips that we took upriver, up the Snake River on a jet boat. And you can see the jet boat is on the bottom. The jet boat is owned by a tribal member. They have a Traditions store downtown. They have the jet boat tours, the Nez Perce tours that they do. And so for 2 years in a row, we've been able to find funding to take a group of kids up the river. And we stop and we talk about historical markers along the river. We talk to them in the Nimi-Putimpt, the Nez Perce language. We show them history spots, historical spots where the people lived, generations ago. And we acknowledge that some of these spots do carry pain, but we also talk about the healing. Prior to 1492, this nation was 100% Native American. Today, the Native American population is 2% of the overall population. So we can look at that from two different lenses. We could say, wow, 98% has been wiped out. Or we can say, we're still here. Despite so much adversity, so much trauma, we're still here. And so that's what we choose to promote within our programs and take pride and have culture be that connection.
Hey, Danielle, about 2 more minutes.
Okay.
I hate this.
Wow, that's fast. And so culture is connection. Also, culture is prevention. So next slide, please. So what we talk about when culture is prevention, we mean helping our youth and our families. And we have 3-generation families attend our programs on the regular. So we have grandmas and we have moms and we have youth coming together to learn, to talk, to connect. And we surround these youth with as many positive adult relationships as we can have. We provide opportunities to do activities with the real deal, with real rawhide, with real Pendleton material, with real feathers. Excuse me. So in this picture, we took the youth on a horseback riding clinic with our Appaloosa horses. The Nez Perce tribe is well known for their Appaloosa horses. We utilize them as often as we can, introduce the youth to the horses as early as we can. In the upper right-hand corner is an tribal elder, and he's teaching these youth about traditional fishing, and then showed them how to do one of our traditional hooks that we use as part of fishing for salmon and steelhead and some of the larger fish. And then in the bottom is another one of our elders who taught families how to make their own teepees. Excuse me. And so these are part of some of our STEM or STEAM activities that we do, teaching science, technology, engineering, arts, and math through a cultural lens. So when we say culture is prevention, sometimes I get asked, well, what does that mean? Well, what we know is that when we provide opportunities for youth and families to come together, learn together, it helps prevent those feelings of loneliness, isolation, detachment, and it provides roots to who they are. Even our non-native students come out of these classes with a better understanding of the what and the why and the how things came about. And that promotes the diversity and the inclusivity that we really want to promote through our programs. It also helps to prevent those negative coping mechanisms, drugs, alcohol, because we've rooted those kids and they find pride in who they are. And they have also made connections with loving, caring adults that they can turn to in those times of need. We also have had youth talk to us about suicide, whether it was their own ideas or if it was a mentor or if it's one of their peers that they're wanting to try to help mentor. We've also found that in teaching cultures prevention, we recognize that there's what we refer to as MMIW, which is missing and murdered Indigenous women, or MMIP, missing and murdered Indigenous people. So teaching culture as prevention is teaching to value yourself as a person, value yourself as a community member,
IUTE,
and for women to value yourself as a woman. Because MMIW is a campaign where there are a lot of missing and murdered Indigenous women, and it goes unreported and it goes unresolved many, many times. So we work with the youth to really instill them to understand your value, understand what you bring to the table. Next slide, please.
I'm going to have to cut you off in a moment, Brenda, but I just want to invite you. Let's find another time also to have you maybe do a peer learning network meeting, and Danielle will be in a breakout room as well. So go ahead.
Okay, so last slide. We really do. It takes a village, and I know that's kind of a cliche. We hear that all the time. However, that's the traditional way of teaching and learning within Indian country. And that's what we try to bring back to the table, is to bring multi-generations to the learning table, where sometimes the youth become the teachers and the elders become the learners. And that's really fascinating to watch, and one of our greatest impacts that we have within our community. So again, like Michelle said, I'll be in one of the workshops, and we can talk more and take a deeper dive into these topics. Thank you.
Thank you, Danielle. And thanks for sharing the stories and the pictures and your own personal. It's so obvious that you are rooted in this culture. That's the medicine and the connection and the prevention. And we really appreciate you being here, especially at the last minute. So thank you. Okay, so those are our solution stories. Let's take a really super quick stretch break. In other words, just if you need to go to the bathroom, go to the bathroom. If you need to grab, water or whatever, grab water or whatever. I'm going to take a couple minutes and just configure in Zoom the breakout rooms, and this is how it's going to work. Almost everybody who's talked has been able to stay and be a part of these breakout rooms. So we're going to have 7 breakout rooms set up. You can join any breakout room you want. We're going to keep them open for somewhere between 15 and 20 minutes, so not super long time, but you are welcome. If you want to sort of sample a couple of breakout rooms, you can go in between, but I think you're going to really get into the conversations, and so probably want to stay. So I'm going to leave this list of, well, I may or may not leave this list of breakout rooms up because, yeah, I think I can now leave the list of breakout rooms up during the break. And if we can just come back in a few minutes, I'll have the breakout rooms set up, and then you can join the one that you want to participate in. So thank you again to all of our presenters, our keynotes, which seems like a million years ago at this moment, and all of the solution stories. Thank you so much for being a part of this, and we look forward to continuing the conversation in smaller groups, and then we'll just come back together. We'll have a short time together and we'll wrap it up. All right, welcome back, everyone. Sorry to cut you off like that again. But I hope you at least got a little bit of a chance to visit. And again,
yes, maybe we could start hearing from groups. Let's start with the group I was in. Mark and Danielle had a great conversation going about, you know, how to connect some of the great work that Danielle and other folks are doing in tribal extension with communities that are close, but seemingly a world apart. So maybe you want to say something about that, Mark.
and I just, before Mark jumps in, just invite you to, we're not going to do this chatterfall, but if you've got new ideas or aha moments, something to kind of share with folks or resources, anything, just please use the chat. And we'll do a little bit of a wrap-up conversation, and then we have a couple of what's next slides to go through. So sorry about that, Mark.
Or anybody that wants to share something they talked about in their breakout. An aha, a highlight for you, light bulb went off.
So in breakout group one, the kind of the aha was sometimes we have to sneak in discussions of mental health because it's such a stigma exists around it. And whether that means we talk to the kids and let the kids talk to the parents, or whether that means we talk about just breathing to relax before we start this conversation and going into, and then Mike casually mentioned, oh yeah, that's just mental health things. We all have mental health. Some of it's good, some of it's bad, but we all have it. And anyway, being a little bit sneaky, but being brave enough to talk about it.
Love it. Love it. Anybody else from your groups? You got to tell me, I didn't get to go to any groups, so.
Chat room 7 got a lot of great ideas on different types of trainings that people have brought into the States. And so really excited to check into some of them. I learned about new ones I'd never heard of before. So
maybe we can follow up with you, Shay, since I'm guessing you took notes, so we can add some of these to our.
Or really bad notes, but yeah.
You can type up your notes and we can add them to the resource guide.
I could read in my handwriting at least, so.
That's right. Very good. Anybody else?
So in chat room 4, we talked about the importance of someone being willing to be vulnerable in order to create the space to have authentic conversations. And I think that really hit everyone in a place that was really authentic.
Julie, to piggyback on that, I think we also talked about the importance of food, of bringing people together. And so if there's funders in the room, that food is not just to serve people's bellies, but also people's comfort level with each other and conversation and bringing out that vulnerability. So food is important for this type of work.
Yep. Other thoughts? Chuck just put in the chat about leading with an activity that gathers the community together. And I think we heard so much of that in all of the presentations today about how gatherings are a part of connecting each other, connecting communities and connecting folks with each other. Other thoughts? I see some training resources in the chat.
Just to expand on that a little bit, Michelle, of course, I talk about Native American foods and stuff all of the time, but that's my audience, right? But we also invite other youth to bring to the table what are their cultures. If they're Hawaiian or have a Polynesian background, bring those to the table. So we try not to have it just exclusive. So I think really knowing your audience and getting in touch with what they want to bring together. The youth that are encouraged to do that, they bring that and their parents come. And it's really a great moment for kids to be able to share their culture and background. So hopefully everyone can kind of offer that to their communities and see what pops out and be able to promote that, because food does bring us together. We love food, so that's a good way to get in.
And I think the other thing that you've said is really connecting with who people are, right? Because so much of what you can bring is rooted in who you are. And if we just think everybody's kind of the same, then we're not really inviting real people. Other thoughts before we wrap up?
Yes, Michelle and Danielle, just to add to what you said, everything that was talked about as far as Danielle's programs are concerned, I feel that all of that really gets to the root of helping people to heal and to move through struggles, regardless of what their cultural background is. I feel that it's applicable to every human being, and you can adapt it to them as an individual and to that individual community, and you can apply it. And so loved everything you had to say.
Great. Thank you, Bailey. So we got to wrap up here. Lori, do you want me to do this? Do you want to do this?
No, so we are going to continue this conversation in actually next week at our next Peer Learning Network meeting that you all are welcome to join. And we'll kind of debrief and updates and whatnot. So please join us. I think it feels like we just all got started on these great conversations, needed, essential conversations, and I would really like to continue this. I'd also like to figure out how to make, I love fostering ripple effects. So if there's some ideas that came from today, some connections you made, and you could use a little bit of money, maybe to buy some food for an event that you're going to have now. We're going to figure out how to get an easy application out to you for applying for some funds to support just that idea friendly, starting somewhere, just do something activity that you are feeling like you're committed to doing right now. So stay tuned for that. I am right now putting and we'll send a follow-up email, but that's a link to our evaluation for this Solutions Roundtable. We will be doing more Solutions Roundtables in the future, including one on accessible communities, meaning how to make communities accessible, especially for folks with disabilities. And so we want to learn from you all what's working, what's not working in terms of these Solutions Roundtables. So please help us out. It'll only take you a couple of minutes. We will be in touch. We are going to add resources that we heard about today. We have a whole bunch already ready to populate our resource guide, but we're going to add what we've learned today, and anything you send to us after today. It should be in the next day or two because we'd like to get this done and posted and the link out to you all quickly. So we'll be doing that. And the keynote and solution stories also posted on the website very soon. And we'll actually have those annotated with times so you know where to go to find Chuck Strand's presentation, Danielle's presentation, etc. So that will take a few days. Yes, Michelle? Yeah, she's had it on her to-do list, but this is our priority for the next few days, is to get all this follow-up done. And yes, please do the survey and feedback. We always welcome it. And again, we don't send out a lot of emails, so don't be afraid to sign up for our newsletter, our WeCAN newsletter, and you'll find out ahead of time what the topic for the Peer Learning Network meeting is ahead of time. And so we are just welcome you to join us as we move forward, trying to solve all these wicked challenges that we have in rural communities. So I was thinking today, that's kind of like, well, in rural communities, we're like Ginger Rogers with Fred Astaire. We try to, you know, make things work, but we're doing it in high heels and backwards, right? So we need to stick together.
I love it. All right. Thank you again, everyone, for joining us today. It's just meant so much to us to have so many folks participating on all levels. So thank you.
Thank you, everyone.
Thank you.
Stay well.